Hello everybody, Assalamu alaikum. Today we'll talk about depression. I'm Atif Absar. Okay, then what causes depression? First of all, I will include the family related history. Having a family members who has depressed may increase a person's risk. Imbalances of certain chemicals in the brain may lead to depression as well. There is really a dangerous thing, and this is the major life changes. Positive or negative events can trigger depression as well. Examples include the death of a loved one or a promotion. Major illnesses such as heart attack, stroke, or cancer may trigger the depression too. Certain medications used alone or in combination can cause side effects, much like the symptoms of depression. Use of alcohol or other drugs can lead to or worsen the depression too. Depression can also occur for no apparent reason too. Okay, let's talk about some main symptoms of depression. Vary from person to person. Two key signs are loss of interest in things you like to do and sadness or irritability. There are also some additional signs as well. They are feeling empty, inability to enjoy anything, hopelessness, loss of sexual desire, loss of warm feelings for family or friends, feelings of self blame or guilt, loss of self esteem, and inexplicable crying spells, sadness, and irritability. And for the depression, there will be a huge chance that the person's behavior and the attitude will be changed. So, this may include general slowing down, neglect of responsibilities and appearance, poor memory, inability to concentrate, suicidal thoughts, feelings or behaviors, difficulty making decisions. I also attached some physical complaints. These may include sleeping disturbances as well as like early morning waking, sleeping too much or sleeping late or insomnia, lack of energy, loss of appetite, weight loss of gain, unexplained headaches or backaches, stomach aches, indigestion, or changes in bowel habits. Okay, every single thing have a type. So just like that, depression also have some common types, and they are major depression, dysthymia, bipolar disorder, and seasonal affective disorder or SAD. Now, I'll talk about the major depression, which is the most dangerous type from the four type of them. These type causes the symptoms that may begin suddenly or possibly triggered by a loss, crisis, or a change, interface with normal functioning, continue for months or year. It is possible for a person to have only one episode of major depression. It is more common for episodes to be long lasting or to occur several times during a person's life. The second type is known as dysthymia. People with this illness are mildly depressed for years. They function fairly well on a daily basis, but their relationships suffer over time. And now it's bipolar disease or bipolar disorder. People with this type of illness change back and forth between periods of depression and periods of mania or maniac disease and extreme high disease. Symptoms of mania may include less need for sleep, overconfidence, racing thoughts, reckless behavior, increased energy, or mood changes are usually gradual but can be sudden as well. And the final one and the last one is seasonal affective disorder or SAD. This is a depression that results from changes in the season. Most cases begin in the fall or winter, or when there is a decrease in sunlight. So, of course, we need perfect treatment for getting rid out of these things. So, professional treatment is really necessary for all these type of depression. So let's talk about the treatments very briefly. So the treatments for depressions may include medication. Antidepressants can help ease the symptoms of depression and return a person to normal functioning. Antidepressants are not habit forming as well. And psychotherapy is one of the most best or the one of the most greatest in treatment that I think. This can help many depressed people understand themselves and cope with their problems. For example, interpersonal therapy works to change the relationships that affect depression. Cognitive behavioral therapy helps people change negative thinking and behavioral patterns. If you or someone you know has symptoms of depression, I'm telling you, take action and take action very perfectly. See a doctor for a complete checkup, go to the counseling center and talk to the counselor, Talk things over with a friend, family member, or a residential life staff member. Don't expect too much of yourself. Take a break, get some exercise, avoid extra stress and big chances. So, what things we should actually do for live better? Things to do: reduce or eliminate the use of alcohol or drugs, exercise or engage in some form of physical activity, eat a proper, well balanced diet, obtain an adequate amount of sleep, seek emotional support from your family and friends, focus on positive aspects of your life, pace yourself, modify your schedule, and set the realistic goals. So we talked about the things that we have to do or that we should do for a live better. Now let's talk about things that we should avoid. Things to avoid: don't make long-term commitments or important decisions unless necessary. Don't assume things are hopeless. Don't engage in emotional reasoning, i.e., because I feel awful, my life is terrible, I would love to die, I would love to go to somewhere alone. Don't assume responsibility for events which are outside of your control. Don't avoid treatment as a way of coping. So, how to intervene with my depressed friend? Be empathetic and understanding. Don't try to cheer up a depressed friend. Avoid critical or shaming statements. Challenge expressions of hopelessness. Empathize the feelings of sadness, grief, anger, and frustration. So we are about the end. You everybody should ask me a question: that how can I help my depressed friend? So helping a depressed friend, like he's my friend. So don't argue about how bad things are. Don't insist that depression or sadness are the wrong feelings to be experiencing. Don't become angry even though your efforts may be resisted or rejected. So, helping a depressed friend: advocate for their recovery from depression, emphasize that depression is treatable, seek consultation, encourage them to seek help, go with them to the counseling center, be supportive of counseling or doctor suggestions. And finally, thank you everyone, thank you and thank you everybody, and thank you so much Healthcare Solutions for giving me an opportunity to express my all the thoughts by a great PowerPoint slide. Thank you so much. Please do pardon my mistakes if I did anything wrong. For contact, you can mail me or you can just give me a message or give me a knock in FB or Instagram. And by the way, Assalamu alaikum. Take care, everyone.